going to start with sodium. Sodium is important for fluid regulation in the body. Hypernatremia is a sodium level greater than 145. Signs and symptoms of hypernatremia would be thirst, fever, dry mucous membranes, hypertension, tachycardia, restlessness, muscle twitching, and hyperreflexia. And the treatment for that would be to give an isotonic salt-free fluid. Hyponatremia is a sodium less than 135. It's the most common electrolyte imbalance in hospitalized individuals. Signs and symptoms for that would be lethargy, headache, confusion, apprehension, seizures, and coma. And you just need to treat the underlying cause. Chloride is important in fluid balance as well, your blood volume and your blood pressure. Hyperchloremia, a level greater than 105. No specific symptoms or treatment, but just manage the underlying cause. Same with hypochloremia, less than 97. It's typical with metabolic alkalosis, and it's common with cystic fibrosis, and you just need to treat the underlying cause. Potassium is important for nerve impulses and maintenance of cardiac rhythms and contraction of skeletal and smooth muscles. Hyperkalemia would be above 5.5, and it's caused by excessive intake or a shift of potassium from the intracellular fluid to the extracellular fluid, or decreased renal excretion. Signs and symptoms would be muscle weakness, paralysis, dysrhythmias, tingling of the lips and fingers, restlessness, intestinal cramping, and diarrhea. Treatment, treat the underlying cause, calcium gluconate to restore the normal neuromuscular irritability. Hypokalemia would be below 3.5, most commonly caused by gastrointestinal and renal disorders or use of laxatives or diuretics. Okay, signs and symptoms for hypokalemia. Neuromuscular and cardiac effects such as muscle weakness, which ultimately can affect the diaphragm and depress ventilation. Smooth muscles, cardiac dysrhythmias, can lead to hypotension, constipation, intestinal distension, anorexia, nausea, vomiting, and paralytic ileus. Treatment would be a diet rich in potassium. The max oral replacement would be 40 to 80 MEQs a day for somebody with normal renal function, or IV replacement at 20 MEQs an hour for adults. You just have to be cautious to prevent hyperkalemia when replacing that. Calcium is important in the structure of bones and teeth, enzymatic cofactor for blood clotting, and required for hormone secretion. Hypercalcemia would be above 12 milligrams, and it's caused by hyperparathyroidism and excessive vitamin D, many tumors, and increases, I don't know what I wrote, sorry. Signs and symptoms are non-specific. You can have fatigue, weakness, lethargy, anorexia, nausea, constipation are all common. You can also have some mental changes and confusion. Treatment is related to the severity of the symptoms and underlying disease. Oral treatment, IV treatment, and large amounts of saline to help excrete the calcium. Hypocalcemia would be below 8.5, and it would be due to inadequate intestinal absorption. Signs and symptoms, let's see. Convulsions and tetany, prolonged QT interval, intestinal cramping, and hyperactive bowel sounds. I'm going to butcher these words. Chauvet's sign is one that you can do to test for hypocalcemia with the facial nerve just below the temple. And a positive sign would be a twitch of the nose or the lip. And then there's the Trosu sign, contraction of the hand and finger when atrial blood flow in the arm is occluded for 5 minutes. Treatment for hypocalcemia would be IV treatment, 10% calcium gluconate. Okay, on to phosphate. Normal range is 2.5 to 4.5, and it's found primarily in the bones. Hyperphosphatemia would be above 4.5. associated with the cell destruction and treatment of tumors with chemotherapy. When those cells get destroyed, it lets out all that phosphate, or long-term use of phosphate enemas or laxatives. Signs and symptoms would be a prolonged symptom would be calcification of soft tissues in the lungs, kidneys, and joints. Treatment, treat the underlying cause. Aluminum hydroxide can be given to bind with the phosphate in the body to be eliminated. And then magnesium. Protein is needed for protein synthesis, neuromuscular excitability. Hypermagnesemia would be above 2.5, caused by renal failure. Signs and symptoms would be nausea, vomiting, muscle weakness, hypotension, bradycardia, respiratory depression, and treatment would be to avoid magnesium-containing substances. And last but not least, hypomagnesemia below 1.5 due to malnutrition, malabsorption, alcoholism, or the use of loop and thiazide diuretics. Signs and symptoms would be depression, confusion, irritability, increased reflexes, muscle weakness, tetany, convulsions, tachydysrhythmias, and treatment for that would be IM or IV magnesium sulfate.